Our last speaker is Professor Andrew Watterson from Stirling University. Andy began by researching pandemics at Southampton University when looking at historical cholera outbreaks in English towns. And since then, he's worked on national and international public health projects for NGOs, trade unions, government departments, and as a consultant for both the World Health Organization and FAO. So over to you, Andy. Thank you.
Right, thanks very much. I'll carry on talking anyway.
Thank you.
Just to say, I'm quite shocked by listening to Hannah there. And I'll come back to some of the points that she makes. In one respect, perhaps we'd be wise to talk less about what's wanted, and in the context of both what Hannah and Surojit have said, more a case of why haven't we got it already? Because there's so much that we knew at the beginning. Obviously, there's quite a lot that we didn't, but there's so much that we knew at the beginning about how we should tackle a pandemic. It's very surprising for a variety of reasons that that's not emerged. So we knew what the key public health principles were for dealing with a pandemic like COVID. And these are on the right there, and I'll come back to them right at the end as well. So what you would expect to see are those key principles underpinning and shaping policy and the sort of practices that are needed and that, where possible, have been tested. And then how the strategy is being delivered is, of course, critical. It's got to be based on credible evidence of what works and what doesn't. And we've already heard from Surojit about a good deal of that evidence. It should be underpinned by key approaches, for instance, low incidence, and the sort of thing that Zerocovid Scotland was advocating right from the beginning. So that's not a reliance on vaccines, because we didn't have them at the beginning, of course. It's not a reliance on treatments, which are now being bigged up. And certainly they're not insignificant part of the picture, but they're not the big part of the picture. It's not about vague exhortations to personal responsibility, which seem to be very much in the mainstream now. The sort of low incidence approach that we've been hearing about, certainly in the Lancet and elsewhere in the last 6-7 weeks, points out that if you have that approach, you protect the public health, you protect the NHS, you protect the workforce, you protect education, you reduce variant risks, you avoid more onerous non-pharmaceutical measures like shutdowns, lockdowns, and so on, quarantines. So the sort of work that Chipienza has done across Europe indicates the value of that approach. And it was there early on in some form. So what you want is a strategy that combines the pharmaceutical approaches with those non-pharmaceutical interventions, like ventilation, like effective best quality PPE, like continuing to use test and protect, and social distancing. And very much in the context of what Hannah has just said, it's got to be about engaging effectively with key groups. And those are the patients, the families, communities, vulnerable people, and workers. And to some extent, some of those things have happened, but they haven't happened very effectively. So what we've now got in Scotland so far, I think, are some really significant failings, as well as some reasonable successes. And I think they're things that we should avoid. So what we've seen is a lacking of some key principles that relate to the public health strategy. And we also appear to have forgotten some of those key principles fairly rapidly in the last month or so. We've allowed pandemic politics and vested interests, I think, to overpower the science, especially in terms of a precautionary approach and in terms of what we know about the physics of COVID, which remain the same in many respects. And we've given too much weight to ideology rather than science. For instance, with regard to the case very early on about ending 2 meters, with disregarding what we know about what is and isn't effective PPE. And again, very much in the context of what Hannah was saying, with regard to neglecting ventilation and the sort of things that should be done, the sort of things that those beyond the individual should be doing and should document. So effectively, we've abandoned measures as well that are relatively cheap, easy to adopt and to implement. And the obvious ones there would relate to having effective masks. And linked to that, and almost as I speak, we're seeing this with the Scottish Government, we're seeing conflicting and conflicted messages, for instance, on masks. So we're told, well, we're going to remove the protections, but carry on doing it anyway. You know, I mean, that seems to be absolutely crazy. We've also seen some knee-jerk reactions to what goes on in the UK, ill thought out responses, and some blunt rather than nuanced responses to COVID in localities. It's been all or nothing. That's certainly what it's looked like at times. And those messages then have been mixed and muddled about how to achieve that. So we've ditched the elimination approach, and then we've ditched suppression prematurely to protect some interests and to fail to safeguard others. We've been too slow to act as the pandemic started, and now we're too quick to end protections when we've actually got space to be much more measured. And finally, in terms of what the Scottish Government's been doing, we're failing and have failed to protect or adequately protect the vulnerable in schools, in the health service, in the care setting, for key and essential workers, and we've failed to protect the most vulnerable, the shielding, and those who couldn't work at home or couldn't study in an appropriate place and could not afford to be sick. And in that context then, we've got the updated Scottish Government strategy. And you may recall that on February the 22nd, the First Minister said we're in the medium threat level, and the sort of principles and policies that were meant to be outlined then show significant deficits. We've seen a statement about we're going to rely on guidance on testing, on self-isolation. We're going to have reasonable measures to reduce risk in premises, and only measures that were necessary and proportionate would be taken. Trying to figure out what those are, as Scottish COVID numbers climb, as surrogates just documented, it's very difficult to deal with if you drop in the key principles and the practices that we know work. We're told that the low threat level is there, so we're not going to have legal protection measures, which is what the First Minister was suggesting. So that'll rely on high immunity from vaccination. It'll rely on effective treatments and good behaviours. It'll rely on hybrid working and targeted tests and surveillance. Yet in the context of high immunity, we've just seen another paper come out in the Lancet from Sarah Barch in the US, pointing out that even when you've got vaccination rates of 80 and up to 90%, there's still going to be significant societal, economic and health damage if you don't wear masks, and there are going to be benefits if you do. So just returning to that one slide, we've got the principles there on the right, which clearly ought to include social justice. And early on, the Scottish Government was good in saying by protecting public health, we protect the economy and we protect society. And those principles should be based on the evidence. They shouldn't shape the evidence. But what in fact we're seeing in some instances is not evidence-based policy gathering, but we're seeing policy-based evidence gathering where facts are being used to fit the particular picture. We know things need to be upstream. We know they need to be preventative and precautionary. And that's about the low incidence, zero COVID Scotland strategy. In terms of the evidence, we've got evidence on transmission, we've got evidence on the physics of COVID, we've got evidence on effective controls, we've got evidence on policies that work and ones that don't, and that's all embedded in clear messaging, which has existed in the past. We've got new evidence now on waning vaccine effectiveness and the consequences of becoming more serious in terms of moving away from low incidence strategies. And we need to avoid paralysis by analysis. Just one quick example of that. UK COVID has got a Protect programme, which has got £21 million in it. And what we heard the other week, some of us, was a set of seminars that were looking at what went on in terms of COVID in the meat industry. And they were actually telling us what we knew back in March and April of 2020. So there's £21 million gone in there for supposedly profound thinking, and they would have been better regulating and inspecting the workplaces. So we know what to do on ventilation. We know what to do on PPE. We know what we should be doing on vaccines. We know what to do on test and protect. We know what to do on quarantine and self-isolation. We know what we need in terms of economic support. We know about actions on social distancing. We've got good, if not complete, evidence on aerosols and ventilation, which was there from March 2020 in some settings. We know about social distancing. We know about best available PPE now, the test and protect schemes, and so on. But yet we've still got this over-reliance on vaccines and treatments, and a rapid move away from elimination to suppression and then to no control. So the sort of policies that are needed there then have got to be citizens first, because that protects society and the economy. They don't relate to duties to end protection. Strange words we got from the First Minister. She had a duty to remove all of these protections, which all of a sudden have now been transmogrified into restrictions, of course. We want that non-pharmaceutical intervention strategy. And we need prevention, not behaviour-based activities, so that we can protect the most vulnerable. And in that, we've got to have embedded and effective risk assessments. And again, very startling to hear Hannah being told she couldn't get a risk assessment without a freedom of information request. This is the exact opposite of the direction that we should be going in. And in terms of practices, they've got to be transparent, which they clearly aren't, even in Edinburgh University. We need timely information to the public generally and to key groups. We need that effective risk assessment. And we need clarity on the sort of judgments that are going to be taken, that are going to be finely balanced. We really don't want to hear Scottish advisors saying they're comfortable with removing the requirements to wear masks, when we hear about so many people, so many individuals who are deeply uncomfortable about what's going on. So we need the application of the key principles, ensuring ventilation, distancing, having PPE at the centre, and test and trace and quarantine. And in that context, we obviously need very effective ventilation programmes, which I think all the way along has been neglected. As I say, it was there in March, evidence 2020 about it, but it just didn't simply work its way through. And now we've got Independent Sage doing excellent work in terms of scores on doors, for instance, a good example of what can be done to look at carbon dioxide monitoring, look at the numbers of people in rooms, and look what is actually needed. And ventilation has been neglected pre-COVID, during COVID, and as we move out of it, it's been seriously neglected too, and not built into effective risk assessments. So I think what we want are strategies that contain those sorts of key elements that have served a number of countries very well and have given us the sort of context that we need for a credible COVID strategy for Scotland. Thank you.
Thank you so much, Andy. That was really, really good and really comprehensive, and I think puts, sets the scene for what we do need in terms of a strategy for Scotland.